Well, hi, everyone. Welcome to today's information session on strengthening your pelvic floor. My name is Macy Lee, and I'm the manager of science and programs for Curves. I love when these sessions are interactive, so I'm going to ask you a few questions throughout today's presentation. You can always unmute or type your answer into the chat. Also, if you have any questions as we go along, please feel free to put those into the chat and I'll answer them as we go. So first question for everybody. Do you ever cross your legs every time you sneeze? Or refuse to get on a trampoline with your kids or grandkids? Or hold back a hearty laugh to avoid running to the closest bathroom? I'd love to hear your answers for these ones. If any of these apply to you, let me know. Seeing a few yeses come in. Okay, so if you've answered yes to any of these questions, there's a good chance you have a weak pelvic floor. First, these scenarios sound painfully familiar to some of us, but rest assured, you're not alone. Bladder incontinence is one of the most common complaints in women, and many of us chalk it up to either childbirth or simply getting older, but bladder incontinence does not have to be something you continue to live with. Research shows that the right pelvic floor exercises can reduce symptoms of incontinence and in some cases treat the condition. The Curves Health and Wellness Education Series, Strengthen Your Pelvic Floor, can help, and it's available in both online and in participating clubs. So what exactly is the pelvic floor? That's a term we hear talked about a lot, but what is it? The pelvic floor is one of the 7 core muscles, and it's often referred to as the hammock muscle of the body because it sits between your pubic bone and your tailbone. This hammock supports your organs of your pelvis, which include your bladder, your uterus, and your rectum, and it kind of wraps around your pelvic bone and that tailbone. Over time, it will begin to weaken with age, with pregnancy and childbirth, and it can struggle to support these organs. It starts to, think about what it's done its whole life. It starts to fatigue. In some cases, a weak pelvic floor can result in bladder and bowel incontinence, and this takes a real toll on women's health. The good news is that there are things you can do to strengthen your pelvic floor muscle. And a stronger pelvic floor muscle not only helps improve bowel and bladder control, but they also reduce the risk of bladder or pelvic organ prolapse, increase sexual sensation and decrease pain with sex, speed recovery after gynecological surgeries, and overall improve your confidence and quality of life, as well as incontinence. One of the best ways to strengthen your pelvic floor is to do the right exercises. You will learn how to perform these exercises in the Strengthen Your Pelvic Floor class, but I want to start off by talking about 3 common exercises you can use to strengthen your pelvic floor. The first one being Kegel exercises. Kegel exercises were developed in the late 1940s by an American gynecologist named Arnold H. Kegel to strengthen the pelvic floor and prevent urinary incontinence in women. Kegels are an effective exercise to strengthen the pelvic floor muscle if you do them correctly. 1/3 of the women who do Kegel exercises do them incorrectly because they engage their inner thighs, their abdomen, or even their glute muscles instead of their pelvic floor. So how do we know we're doing them correctly? Well, we got to make sure that we find the pelvic floor first. So one of the ways to find your pelvic floor is to kind of squeeze or uplift your vagina as if you were kind of holding onto a tampon or squeezing as though you're trying to avoid passing gas. These are your pelvic floor muscles. You should feel these muscles contract and move, kind of lift up a little bit in that pelvis area, a little bit from the front to back and a little bit of a lift. To do Kegels, you want to go through the following steps as well. You want to make sure that you're sitting or standing in a correct position so that you want to have your shoulders right over your hips. You want to have good posture when doing this. We want to avoid slouching. Then we want to contract our pelvic floor muscles. So again, feel that uplift and that gentle squeeze of just the pelvic floor and try to hold it for 3 to 5 seconds. Then relax for 3 to 5 seconds. Repeat this for about 10 times. And over time, work up that contraction to about 10 seconds. And I'm going to be honest with you, this is a great thing to do when you're sitting in your car at traffic lights. What else are you going to be doing, right? Who knows you're working on your pelvic floor? Squats are another common exercise we use to strengthen our pelvic floor. You may not necessarily think of squats when you're thinking of pelvic floor exercises, but when done correctly, squats are very effective. Your glute muscles will thank you too. So to perform squats correctly to strengthen the pelvic floor, we need to first of all make sure that we're standing with our feet hip distance apart, flat on the floor. We want to make sure our feet aren't too far apart in that wide leg stance because then it makes it harder to target our pelvic floor. So just hip distance apart. We again want to make sure our shoulders are right over our hips. We want to engage our core. So we want to make sure that we're not going to bear down as we do this, but we have a nice solid core. And then we're going to bend our knees and lower into that squat slowly, bringing our buttocks back and our knees slightly over our toes. And then slowly push up to that start position. The biggest key with this one is to engage the core to make sure that you're not bearing down, because that bearing down is what's going to put extra pressure on our pelvic floor. And last but not least, hip bridges. Hip bridges are also known as glute bridges or bridge lifts. These are a great exercise to strengthen the pelvic floor, and it helps strengthen your glutes and open up your chest. So to perform this one, you want to lay on a flat surface on your back with your knees bent, feet flat on the floor. You're going to place your hands by your sides with your palms facing down, and then you want to inhale, engage your core, and lift your hips up towards the ceiling, lifting your butt off the floor. Don't lift your hips so high though that you arch your back. You want to create a nice straight line from your knee through your hip down to your shoulder. You want to hold this for 1 to 2 seconds and then lower back down. Try doing this for 8 to 12 reps. At Curves, we have more than 30 years experience in women's wellness and helping them achieve happier, healthier lives. Learn these exercises and more in the Strengthen Your Pelvic Floor Health and Wellness class. You can sign up today by reaching out to your local Curves coach or by going to curves.com and then programs. And signing up for this class will help you manage your symptoms so that you can enjoy a life without constantly having to look for the nearest restroom. Plus, you're going to boost your confidence and improve your overall quality of life so that you will able to live your best life. Again, you can talk to your local Curves coach or go to curves.com. Next week, I hope you join us as we're talking about should you be exercising with arthritis? If you have any questions, more than happy to answer those for you.